Schools are closed in 6 states and Washington, D.C. in response to the coronavirus pandemic. Maryland is on that list. Joining me now, that state's governor, Larry Hogan. Governor, thank you very much for joining us. Tell me about your decision to close all the schools in your state.
So yesterday, we took a number of unprecedented actions based on all of the best advice from our coronavirus response team, which was made up of some of the top health professionals in the world, from Johns Hopkins University and from some of our other leading medical institutions across the state, and our entire executive branch. One was closing all of the schools in the state. The other one was a ban on mass gatherings over 250 people. And we also activated the National Guard and took a number of other steps. But we've been in a state of emergency for about a week, and we've been taking daily actions to try to stay ahead of this crisis, just because our primary concern is protecting the people of our state and to keep this virus from spreading. And we want to get out ahead of making some of these decisions. The earlier you make the decisions and take these actions, the better it is to kind of bend down the curve and to stop the rapid spread of the disease.
Governor, what are the plans? Governor, what are the plans for children who might be getting their hot meals at school, or their meals, or potentially a daycare at school or more?
Yes. Actually, they will all be getting their meals, and that's one of the things that we had long discussions with our superintendent of state schools. She had a call with all of our local county and city superintendents of schools to make sure that all of those meals will be provided. We're making arrangements to both provide them at the schools for people to come get them and or have picked them up, and we're arranging for delivery of the meals to all of those kids. Daycare is something that we're also concerned about. Large gatherings of daycares are just as dangerous as the schools, so they're taking actions to put in precautions in place to try to help people with the taking care of their kids who are out of school, but also to protect those kids by maybe implementing some social distancing and smaller groups of kids, and making sure that we're taking every precaution to protect them.
What about the parents who can't stay home from work, or who are going to stay home from work but will lose their hourly wages because now they have to take care of their kids?
We're also passing emergency legislation to try to take care of those folks, and we're working with the federal government, who I believe Congress may be taking action as we speak to try to address some of these issues. So as far as unemployment insurance, we're hopefully passing today in our state legislature emergency legislation to take care of some of those issues. But it's obviously going to be a major disruption in people's lives, and it's going to cause a great deal of difficulty. These are not decisions we take lightly, but we're taking them out of we're trying to make the steps that we believe are necessary. They may cause concern. They're certainly going to be disruptive, and they may be scary, but we believe that they're absolutely necessary to keep the people safe.
I don't know if you were listening to the interview I did a moment ago with a couple of doctors, and one of them is a doctor in Florida who's at the University of Miami, and they say that they have those tests available, but there's a lot of governmental bureaucratic red tape, and asking him who could cut through that, he said it was the President of the United States. Yeah. So when you hear something like that, I mean, I wonder from your perspective, are you getting what you need from the president? Is he cutting through the red tape that you need to be cut through in order to protect your citizens?
Well, look, the last thing I think we need at this point in time is finger pointing or Monday morning quarterbacking or talking about the mistakes that have been made or what could have been done better or how we should have had more testing ready, because the reality is, yes, we have a problem. There's not enough tests. We're dealing with that crisis right now in every single one of our states, and we're trying to fix it. And it's not something we're going to fix overnight, but I do believe that people are aware of it. They're trying to address it. But, yeah, we're behind. In our state, we were one of the first to be approved to do our own testing. I know that Johns Hopkins University, one of our leading medical universities, we're the home to the FDA, to NIH, to Johns Hopkins, University of Maryland Medical System. They're all working on the possibility of ramping up. We've now got private labs like Quest and LabCorp and others that are trying to ramp up production, but it's just not going to be fast enough. And so the real concern for us right now really isn't about testing. It's about stopping the spread, social distancing measures, preparing for the kinds of things we can do to stop and slow down the growth. And quite frankly, at some point, we're not going to be arguing about the testing. We're going to be worried about taking care of sick people.
Are your hospitals prepared? Because when you talk to folks in Italy, they didn't see this coming. And there are people in this country that worry that our hospitals are going to be quickly overwhelmed.
So we took unprecedented actions, probably more so than any other state in America, including a couple of weeks ago, we put together this coronavirus emergency task force made up of all the top medical professionals who came up with a list of suggestions and ideas. In those discussions, quite frankly, there are major concerns among medical professionals about overcapacity, surges on the hospitals and emergency rooms, and discussing what happened in Italy and places in Europe. And so we're actively looking at plans for how we can address those needs. And it's something that every governor should be concerned about, that the federal government needs to be focused on and concerned about. And it's one of the reasons why we took the unprecedented steps we did. It's one of the reasons why we called up the National Guard. And we're addressing those issues with all the hospital leaders and all the smart scientists and professionals across our state to say, what can we do to ramp up and catch up and get into a position where we can actually do the best job we can, rather than talking about what they didn't do in planning and what why the hospitals aren't ready or why the tests aren't ready. I just want to say, what can we do right now today? What actions can I take as governor?
Yeah, I don't want you to. I'm not asking you to snipe.
Implement things.
But let me ask you this: what do you, if you could ask the federal government or this administration right now for what you need? What do you need right now?
Well, we're in constant communication with the federal government. Let me say this. I'm the chairman of the National Governors Association, and I was in the White House Situation Room twice in the past week. We had 2 conference calls with all of the nation's governors, but both Democrat and Republican. I was sitting next to Vice President Pence. We had all the leaders of the federal agencies. There's concerns among all of us about what we don't have and don't need. They're being conveyed directly to the cabinet secretaries and the folks at the level. And we are doing that. But I'll say this, they have done an excellent job of reaching out to the states. While they haven't been able to meet every request or meet every need, just like we're not able to, they've been in communication. It's not like I have to, talk to you to say what would I tell the folks in Washington. We are talking to them all day long, every day, and all of our agencies are as well.
But do you think they're working fast enough?
I think everybody's working around the clock. Both at the federal, state, and local level. It's not fast enough. It's like digging in the sand.
Vice President Pence said
they're not.
Yeah.
Yeah.
So why is it?
They are not going to be able to get the tests wrapped up in time.
Why is it so slow? Why is the response so slow?
Well, that's a great question that I don't have the answer to and don't really have time to argue about, because worrying about what the tests are or why they didn't have them doesn't really matter to me right now.
I'm not asking you to worry about why they didn't have them. I'm just wondering, what's taking so long? And as somebody who's been in the Situation Room and had those discussions with the administration and everybody who's trying to work on it, I just, you're in a good place to potentially answer that question.
Yeah, everybody's trying to work on it, but I don't believe they can ramp up fast enough. That's the simple answer. We've moved on from testing, quite frankly, to other things right now.
What are the other things?
What's that?
What are the other things?
We've moved from containment to mitigation, and quite frankly, at some point soon, we're probably not going to be into testing as much because the hospitals will be overwhelmed and unable to do the tests. So we're going to be looking at how do we ramp up hospital capacities? How do we worry about, taking care of folks? All this arguing about what they didn't do in testing and can they get it up to speed in weeks or months or whatever. If you take a look at how fast things are happening, not just on a daily basis, but on an hourly, almost minute-to-minute basis, as we're sitting here talking right now, there are probably things that have changed, and we just have to stay on top of it the best we can, and we've just got to have everybody trying to do their best at the federal, state, and local together, local government on one team. All we're really concerned about is the people we serve.
Maryland Governor Larry Hogan. Governor, thank you very much for your time. We appreciate it. Good luck.